Good evening, everybody. Hey,
Hello.
Anne-Marie. Gosh,
Hi.
hi. We are back from the Hagwood Mill Paracon. We had such a wonderful time. Anne-Marie and of course Dark Hair's Paranormal Chris and Kristen and our loved ones were all there. We got to meet and hang out, and we didn't want to come back. We were enjoying ourselves so much, so it was a
Ready
great
to go
time for
back.
everybody. Yeah, I know. The beautiful weather. It was beautiful. It was windy, but we had some pretty sunshine in there for those of you that are getting covered up in snow right now. Tonight we have a returning guest. We had her on last week, but there was so much more to talk about and more questions that people had that we decided to have her return tonight for part two. It's Dr. Renae Nagle. She, as you know, her biography, she's very, very multifaceted in many fields and has a very, very high education in many, many things. So tonight we are going to be talking about, connecting with the other side and some other things that she wanted to talk about that her guides are telling her need to be conveyed at this time. So get a piece of paper and a pen. You may want to write some stuff down. This is going to be a very, very intense, detailed show. Also, I wanted to make mention, as usual, Synchronicity adding pieces to the puzzle is a next level paranormal. It is an advanced paranormal where we're talking about things because we already know they exist. So we're just going and broadening with that sort of thing. Tonight, she will be taking questions. It will be at the very end of the podcast. If you have any questions about what she's talking about, please write them down during the podcast so that you can ask her the questions at the end. So without further ado, we'd like to bring in Dr. Renae Nagle. Welcome, Renae. Thank you so much for agreeing for joining us again tonight. We're still a little bit hyped and hyped in one way and half asleep from being at the Paracon. But when we left off on the last show, we had so many people that enjoyed it so much. You got so many views, and it brought more questions to people's minds that I think that they're ready to hear what you have to say. I was wondering with the topic that you were wanting to talk about, I wanted to know if you, how do you explain, for instance, the process of connecting with a person who has crossed over to the other side from the perspective of higher conscious? Like, for instance, Teresa Caputo, she's the Long Island medium, and I'm sure most everybody knows who she is, the lady with the big blonde hairdo and fingernails. She frequently makes the statement, "I don't know how what I do works." Can you enlighten us a little bit on how this whole thing works?
Hi, ladies. Thank you for having me on the show again. I really appreciate it. This is a really complex subject matter. It has a lot of historical connotations that are not accurate. And I want to present it this evening in a place that's more of a current contextual type of educational piece, because most people, when they hear this word, as far as spirit releasement therapy or entities or attachments or shadowing, whatever that is, they have a negative connotation that's based on religious dogma, or words like exorcism from, the Catholic Church or Christian religions, because in those days they would call it demons, okay, because they didn't understand it, a energy system or higher consciousness paradigm or perspective. So how I wanted to start was to convey that, and I have some notes, so just kind of bear with me. Until the phenomenon of near-death experience was conceptualized, people didn't understand this process. And the question of an entity influencing a person made little sense in most of the medical communities and the psychodynamic or psychological communities. So instead of taking it seriously and understanding it as a form of higher consciousness, an energy system of communication of the collective unconsciousness, they kind of put it to the side and said, well, that's, either fake science or pseudoscience, or it's woo-woo. That was a typical terminology that was used. And even people who have a background in hypnosis, like I do myself, oftentimes they'll take those terms and they'll use them and really kind of bastardize them in a way and not really educate the populace or the public as to what that really is. So, near-death experiences were actually proven by Dr. Raymond Moody in the late 1970s. And you don't have to believe me, you can just do the research. Follow the bread trail of the research, and you'll find that there are many people that have done research in not just forms of collective consciousness, like Dr. Carl Jung of Jungian therapy, but many other well-known scientists, physicists, physicians, psychotherapists, psychologists have really explored this whole concept of death and dying near death experiences. So, if any of you watch television, which I'm sure many people do, last week, Drew Barrymore, who is a very popular actor, has her own television show. And she had a person by the name of Teresa Caputo on it. Teresa Caputo is a well known psychic medium. Now, some psychics aren't mediums, but most mediums have psychic abilities or intuitive abilities, of which we all have. It's just we're not taught to trust our intuitive abilities because we all see, hear, feel, and know things. In any given moment, we just ignore it. We don't pay attention to it. So, on that show and many other shows or shows that Teresa has done, she often says, well, I've been doing this since I was a child, but I don't understand how it works. I know why I'm doing it to alleviate the person's symptom profile or their suicidal ideation or their grief and loss issues or depression, but I don't understand how it works. So, one of the things that I'd like to do is present this to the public that this is not something that is unusual or non scientific or woo woo, okay, as many people would like to say it is. It's based on the universal laws of consciousness and physics. And in the laws of physics, energy does not die, it just changes shape or structure or form. So when a person's body, their physical body dies, that corporal body, while that may go and disintegrate, the person's psyche, their consciousness, their energy systems do not die. They just structurally change into this higher form of consciousness that we call the collective consciousness. And anybody can access that in any type of meditative state, whether that is you're doing, yoga or Zen or Buddhism or any form of just walking in the park in a forest. You're going to go into an alpha state in your frontal cortex of your brain, and you're going to access those higher states of consciousness. You probably go in and out of trance 1,000,000 times a day. You could be in your car from point A to point B, and then you get to point B and you go, gee, I don't even remember that I drove here. Well, because there's that higher self, that higher consciousness of you that's always awake, whether you're sleeping or not, or awake in the alpha state. And it's always leading you to take care of you, to watch over you. Well, that state of consciousness does not die. And there has been so much literature and research that has been done on death and dying and consciousness, but most people are not aware of it because how it's presented on television is it's the paranormal, it's ghosts, it's hauntings. And while all those things are very entertaining, it's putting out a misconception to the world
Yes.
about what's really happening. I'm getting goosebumps up and down my body because
Yes, so am I.
I'm getting goosebumps. Okay, so when people are presented with something, they're being given a truth that is being given by the person who wants to, have control over that situation, whatever that paradigm is, whatever that message is. It's called suggestion. Salespeople do it every day. You see it on billboards, all the pharmaceutical companies every day with the commercials, they're planting suggestions in your subconscious programming. And why do they do that? Because they know that your consciousness is going to hear it. and it's going to digest it and process it, and it's going to stay in your body. It's the same thing when you hear a song 5, 10, 15 years later, you know all the lyrics to that song. And why? Because it's in the frontal cortex of your brain and the columnar cells literally stored forever. But that higher form of consciousness is what Teresa Caputo is tapping into. She sees, she feels, she hears, she knows the deceased person or spirit that has crossed maybe into the light, okay, but maybe not. Maybe they've attached to the loved one's energy field for whatever the reason. Sometimes spirit doesn't want to cross into the light for a multitude of reasons. But I wanted to explain briefly that's how Teresa does what she does. And most mediums, that's what they're doing. They're tapping into that consciousness that we can all tap into if we just know how to do that. And we should be taught this, that this is normal from a very young age. Most children intuitively know these things. It's only society, okay, that they're taught not to pay attention to it, to ignore it, okay, that that's not important. But just as you can't see or explain, maybe you can see love, but you maybe can't explain the principles of how it works. Children are intuitive. They can tell the minute a person walks into that room, their energy, and if they like you or not, if they should trust you. Why do you think children usually hide behind their mother's leg when a stranger walks into the room? Because they're picking something up. They're not sure about that person. They're not feeling safe. So they're energetically feeling that energy. That's the same thing that Teresa's doing. Now, sometimes she's very accurate. And most of the time, if she's giving information and the person isn't aware or it's not clicking, it's not because she may not be tapping into that and getting the correct information. It's because in that moment, the person is not even going there, because it could be 5, 10, 15 years prior that something happened with a person or a friend. And then later on, they may go home and talk to somebody and go, oh, now I remember she was actually right. Okay. So whenever I've done therapy sessions with clients in my sessions, for instance, if a client comes in and they're suicidal, oftentimes, not only will I do the psych assessment, because that's part of my clinical training, but I'll also hear the person that crossed over saying to me, I understand that my son is suicidal. Can you give him a message for me? Specifically, that only the two of us would know. So he would know that I'm okay on the other side, which is what sometimes they call heaven, right? There's many terms for it. So that he can grieve my loss, stop feeling suicidal, know that I'm okay, and that he needs to continue with his life. Because just because a person dies doesn't mean the person who's left behind has to stop living their life. But oftentimes there's a lot of guilt around this. Now, if I'm going to kind of go into this next question, why do I facilitate these connections and speak with someone that's crossed over? Well, there could be a multitude of reasons. Grief and loss is one very, very strong thing. When someone's loved one dies, the person who's left behind, they may have all types of unresolved issues. And when you're grieving the loss of a loved one, whether you got along with them or not in that lifetime, whether it was a positive or a negative experience, you're still going through this 5 stages of grief. And so those stages of grief are very profound, and nobody knows how long those to work through. They're very individual to that person. However, many or most, if not most of all, shadowing or entity attachments are the spirit of the loved one that maybe has not crossed over. And they may still be earthbound, and they could be earthbound for a multitude of reasons. They might have been murdered, right? They might have had an accident, suffered through a natural disaster, and so they're disoriented. And a lot of times they don't know that they've died. So they attach to the loved one. They attach to the loved one, or maybe a child who died. Very confusing for a child, right? They don't know where they are. They're going to hide, within that parent or that mother because they feel safe. they don't know that they've died out of their body. You know,
Mm.
they're very disoriented. And so a lot of these souls can't cross into the light to cross over to the other side because they're dazed and confused. You know, if somebody is murdered, they're in shock. They're dealing with anger. They're dealing with rage. They might be resentful that somebody killed them and hurt them. And so when that happens, okay, they might want revenge. So sometimes when you see some spirits in paranormal experiences doing nasty, negative things, right? They're angry because they're ticked because you killed or you murdered them. And so they're feeling feelings of anger, rage, and revenge. So they may not want to go into the light until they, get their just due, right? And even when somebody dies, that doesn't mean that their emotional or psychological processes or issues have been resolved. You just don't cross into heaven and you're good to go. Okay. You still have leftover baggage that you take with you. So
Mhm.
it could be a suicide. It could be a depressive or obsessive kind of, somebody who has OCD. And oftentimes, in a psychodynamic or psychotherapeutic approach, if a person has a diagnosis of OCD, psychiatrists, doctors, they want to put them on medication, right? To monitor that behavior because OCD can get them into a lot of problems in life and create a lot of issues in their personal relationships or their business relationships. But a lot of people who have OCD don't realize that perhaps when one of their loved ones died, they attached to their energy or shadowing them. They could be in their auric field or they could be inside of their body, okay, causing
Mm.
disturbances in their psychological functioning or their physiological functioning, which could create, organic medical conditions even. A parent that may have been on a respirator and have respiratory issues, then when they die, don't want to cross into light, they attach to a son or a daughter, and then that person becomes symptomatic and they start having these issues. And so, there could be many, many other reasons. Um, or the person has an inability to want to move forward. The entity, the spirit, they might have a sense of grief, guilt, shame. Maybe they did something wrong to that person and I want to stay and try to make it up to them. Okay. And so there's so many reasons, that psychological, emotional reasons, that someone who dies out of their body does not cross over into the light. And they have unresolved trauma. Just as I do EMDR or hypnosis with a live person for their traumatic events, I have to do what's called spirit releasement therapy with the spirit and or attachment and or shadowing part of that person to say, hey, who are you? Why are you here? Okay, why have you attached to this person? Do you understand that you're taking the energy that that person needs to live their life? And do you understand that this is also preventing your soul from evolving into the next stage or level of possibly another life in a different body, in a different time or place? And then there are other entity attachments. And I really want to say this very carefully. I think what mediums do performs a wonderful service to humanity because they touch upon issues that most psychotherapy or psychotherapists can't, because our profession prevents us from doing that because they say it's not evidence-based, cognitive behavioral. Insurance companies won't pay for certain things. I've had to do hypnosis, like, behind the scenes in a treatment plan. Sometimes I can't say that I'm doing it because the insurance company might not pay for it. But a medium is performing a very valuable service because they might be saving somebody from committing suicide, like a Vietnam veteran or a veteran of the Persian Gulf or any of the wars that veterans, when they come back, they have traumatic PTSD symptom profiles. Well, some of those veterans might be bringing back entities of their combat colleagues that died in a war that have attached to their energy fields. Now, how would you even know that that happens? But with a medium, when they're talking to somebody and doing a reading, they might say, hey, I think you have an entity attachment, okay, that was from a past life when maybe you lived in Egypt. However, they can't always read everything very clearly. And only through maybe me doing some type of hypnotic regression can I determine categorically whether that was a past life issue of an entity attachment or something else in this time or place from a deceased loved one, or even a hospital stay where the person went in for surgery and came out with these feelings of, oh, I feel like somebody's in my body. I've got these symptoms that I never had before. Okay, because hospitals are notorious for what is called death, right?
Yes.
And if a patient dies in a hospital bed, you know, when they come in, they might disinfect the room, but they don't do a spirit releasing therapy to check to see if there's any entity hanging around that didn't want to cross into the light for whatever the reason they want to cross into the light. And that person could take that spirit or that attachment or that shadowing home with them in their energy field, and then they become symptomatic. They might actually demonstrate a physiological condition that they never had before, you know.
Wow.
I mean,
That's crazy.
that's why I said this topic is so complex and complicated that most people have no idea. They don't even understand the dynamics of any of this behind this. And in my profession, they don't train us in this in school. I went through two-year internships in an inpatient psych facility and an outpatient mental health facility. You think anybody ever once talked to me about this? Not once, because they can't even conceptualize or consider that why this is happening, because the body has what's called a core self. That core self is with you from before you come into the lifetime, where they plan your life. Okay, that's your astrology. Your astrology chart is your life plan, essentially. And that core self is with you your entire life through your death transition to the other side, or to heaven, or whatever you want to call that place. And that core self is made up of a body, a mind, and a spirit. And when you go through a traumatic event, whether it's a natural disaster, a murder, okay, a death from a heart attack, whatever those situations are, it doesn't matter, because energetically, that core self has been traumatized because nobody prepared it for death and dying. There's a book called The Tibetan Book of the Dead, and you can read it. It's very lengthy, okay? You know, it's not the kind of book, you know, you just read and you just zip through it. You have to read it and understand it and digest it. But they teach you about the stages pre-death to prepare you for death, so that you're not in shock or in fear. And it's a natural transition. Death is a natural transition. It is not the end.
Just like birth.
In Egypt, it's only the beginning. That's why with the pharaohs, they always made those chambers, right, for the king and the royal consort, okay, because they knew that death of the physical body was not the end, that energy, that psyche, the personality would live on in a different form. You know, so the core self itself never dies. It's just merely a change in energy. And one day, okay, as things are proven through the laws of physics, medical professionals and psychotherapists are going to understand, even psychiatrists who put you on drugs, they're going to understand that those drugs are merely a Band-Aid to put on a symptom that has nothing to do with what they quote a mental health condition. Because most people who have a mental health condition, okay, have had a traumatic experience or a traumatic life. and their energy fields are stamped with those traumas. And then on top of it, you'll have the energy of the entity or the spirit that doesn't want to cross and leave the body. I always tell people, be careful when you go into a bar and you're drinking and you're smoking cigarettes, and then you start to feel bad day, 2 days after. You don't feel like yourself. You feel like there's something in your body that you're having these thoughts that are negative. You're thinking about hurting yourself or hurting somebody else, shooting people, things like that. Where does that come from? Well, you're in a bar and entities like to siphon off and suck off of the energy field and get a contact high from the alcohol and the cigarettes and the drugs.
I've seen more shadow people in bars than I have anywhere else.
Yes.
I've seen more anywhere else.
Whenever I go into a bar, first thing I do when I come home is I pull out my sage.
Salt bath.
Okay. I take an Epsom salt bath. I throw all my clothes.
That's what I do.
I wash myself. I throw all my clothes in the washer. And then I might even walk through my house and go and do in sage, because I have a Native American, background among my many other things. Okay. I will clear my house, because in the next couple of days, if I start thinking about negative things or feeling like I want to hurt myself or I'm raging, that's not me. I'm a helper. I want to help people. I'm a good person. I'm not thinking these negative, horrible thoughts. Where is that coming from? I probably have an entity attachment. When you're a light worker, whether you work as a doctor in a hospital, a nurse in a hospital, a paramedic that goes out on ambulance calls and brings dead bodies back in their ambulance, okay, right? A light worker that does Reiki or massage, a psychotherapist, anybody in the helping professions, a minister. Think about it. When your thoughts and your feelings and your behaviors start to change that are outside of the person that you really are, you need to be thinking about maybe you have an attachment, and maybe you need to have somebody help you clear it. Now, there can be many ways to clear those attachments. You can do it yourself. You can go into a meditative state, okay, breathing in, breathing out for a series of breaths, and maybe putting on some peaceful music, be in front of an altar where your crystals are, okay, go into a Zen state, do yoga, and ask for your higher self, your angels, Mother Mary, Jesus Christ, Buddha, whoever is your guru that you utilize. And then ask them to scan your body and to release with love into the light anything that may not be of you.
That's what I do.
Okay? Because there's something attached to you and you're not feeling right. You're not
If it's
thinking
not
right.
for my highest good is how I place
It's
that.
absolutely
how I
not for
word
your
that.
highest good. And there are so many ways that you can do it. Now, with me in a client session, I just do hypnosis. Okay? Because it's the most expedient, quick way to have somebody go into a trance. I talk to their higher self. I say, how many entities are here? Are there entities? And oftentimes I'll use like what's called the finger with hypnosis. One finger means there's one entity. 2 fingers means there's 2. It's very basic. It's easy. It's not a big deal. Okay. And then I will go through and see, okay, are there entities here? And then if I determine that there are, and this is after I do a clinical assessment, because I want to make sure, what else may be going on with that person. It could be a physical, issue, a medical issue. I don't know until I do an assessment, but I do my assessment and then I do a hypnotic procedure. And then I start to check to see, okay, so who is this entity? What's its name? Does it know the year it died? What's the situation around its death? How did it die? Okay. How did it feel when it died? Right? Was it an accident? Were they murdered? Was it a natural death? Were they alone? Were they with their family? I mean, I'm doing therapy basically with the entity first, the spirit first, because I need to clear that piece first before I can go and do the issue, the real issue that the client maybe came to see me that has to do with something totally different. But until I access or assess what that is and why the spirit is there, then, I'm just kind of guessing, because even though in my profession, we're given certain educational components or protocols about how to do a clinical psychological assessment, or a psychosocial assessment is what they technically call it these days. Okay. Even though I'm doing that, right? Hey, unless I have some intuitive abilities and I'm tapping into their guides and my guides and they're talking to each other and I see, hear, feel, and know things because I am a medium too. All right. I'm kind of working blind. Okay. And the client I'm treating is working blind. So I have to go through my therapeutic skill sets along with my intuitive medium psychic abilities and work with the client as a team. It's not me curing them or fixing them. It's me working with them as a collective consciousness together and discerning what is it that's causing this symptom that they've presented in my sessions. So if I go into the next thing with addictions, okay, and schizophrenia, these are two very difficult diagnoses to work with a patient or a client, because they can have many origins, but yet they're so all encompassing. If you have an addiction, whether it's to alcohol or a drug, okay, you're not only psychologically addicted, you're physiologically addicted. And it not only affects your thinking and your feeling processes, but it affects your immune system. And if you have an addiction, is that addiction from initial sensitizing event from when you were 13 and you were out with your teenage friends and they made you drink a bottle of Mad Dog? Okay. Anybody remember that from high school? I do.
Mhm.
I do.
I remember a day
Yep.
in high school where I was out with friends from high school.
Mhm.
They were all drinking Mad Dog. Now, I don't know, but I've always been this way. I've always been the person who stays straight and sober, because I always know that somebody is going to do something stupid and I'm going to have to be there to pick their butts up and make sure they
Or
don't.
to tell them the story the next day of what really happened because they
Exactly.
don't remember.
Well,
That was always me.
well, yeah, I get that. But with me, it's more like intuitively, I just feel, I just know something bad could happen here. And somebody has to be thinking clearly, because somebody has to be able to jump in and save the person from stupidity because they drank too much. And I had a friend, a high school buddy. He's deceased now, but he drank so much and he was in such a bad state. And thank God that I didn't do that. And I was there to help him get to where he needed to go to get home, because he could have died from an alcoholic overdose because he drank too much. So when you have an addiction like that, you may attach these entities, like I said, that want to get high. Now, there's another mental health condition that the diagnosis is schizophrenia. And with schizophrenia, most people say, well, there's no real solution, cure, resolution for that diagnosis. It may be genetic in origin. Well, research really hasn't proven whether schizophrenia is genetic or not. And I actually have a colleague now, Dr. Michael Lynch, who's actually been working with the subject matter, and he's been doing his research. And I think someday he'll be able to prove whether there is or there is not a genetic link. However, when I'm working with a patient who is a sexual abuse survivor and may be diagnosed with multiple personality disorder, and they go into these fugue or dissociative states where they splinter off the part of their persona, their spirit, it's like it compartmentalizes in a little box, right? So they have one personality here in a box, another personality in a box. Well, with schizophrenia, it can be similar but different, because with schizophrenia, you could have somebody who was fine up until the age of 13, 14, and some in in psychodynamic circles, they say, well, schizophrenia usually presents itself between the ages of 18 it in your 30s. Well, wait a minute. Is it genetic or isn't it? And why is that? Why are the age differences that way? Well, if you do a thorough biopsychosocial assessment and you find out if anyone died at whatever the age that that child became symptomatic, I bet you that you'll find that that person who died may have attached to that child at that particular age. And that child became symptomatic with hearing voices that tell him to do stuff. What if that person was mentally imbalanced and had bipolar disorder? Or
His
they had
ears were ringing.
or they had, that's Michael. Hi, Michael.
Mm-hmm.
Love that man. He's brilliant.
We do too.
He's brilliant. Anyway, so what if that attachment, that shadowing, that spirit that had maybe say bipolar disorder and was symptomatic attached to that 13-year-old child? And sometimes with these diagnoses, you hear things, you see things, and doctors say, well, you're schizophrenic or you have schizoaffective disorder, whatever the diagnosis is, or you're hallucinating. Okay, well, why are you hallucinating? If you weren't hallucinating for the first 12 years of your life, why all of a sudden at 13 are you hearing voices? Well, maybe when you did the psych assessment, you found out that a grandfather who had these psychological disturbances died. The child attended the funeral or the wake. The grandparent decided for whatever reason they weren't crossing into the light. Okay. They attached to the child's auric field or their energy field. The child starts to becoming symptomatic. Well, then the child presents in my office this way. The child could have been to a doctor, medical doctor, a psychiatrist who put him on drugs. Okay. But he's still symptomatic. Well, I'm just going to do my thing. I'm going to do my clinical assessment, but then I'm going to scan the child. I'm going to do a hypnosis scan. I'm going to see if there are any entity attachments. I guarantee you there will be an entity attachment. And when I say to that entity or spirit, who are you? Why are you here? Do you understand what you're doing to this child? And do you understand that life is so much better if you cross into the light? And I have to really do psychotherapy on the spirit who's attached to the child before I can treat the child and make sure that he's free. And it's a process. They don't just come into my office, spirits, and, just say, yeah, I'm going to work with you. Yeah, I'll cross into the light. No problem. I'm tired of staying here. No, you have to really work with that spirit to get them to agree. It's like a treatment plan I have to do with the spirit and the client. I have to get the spirit to agree to say, okay, now, what is it that I can do to reassure you that when I cross you into the light with your permission, because you still have free will as a spirit, which most people don't understand, that the creator God gave us free will, whether we're in a body or not. And if you choose that you don't want to cross over and you want to stay stuck in the gray zone, you can do that. But here's my problem. You're preventing my client from living a full life. You're causing them psychological and physiological disturbances, and they're not free to live their life. You're cheating that person of their life, and you're cheating yourself of your soul's evolutionary process. So I, as a psychotherapist, have to do psychotherapy and talk to that entity and get them to agree. Then when I get them to agree, then I have to figure out, okay, now how is this person going to cross into light? Because maybe the person was a dark personality and they don't believe in the light. So then I have to do some therapeutic techniques where I have to have them literally go inward to themselves and look for what I call the pearl, the little pearl of light. To see like a little pearl, like the pearls I'm wearing. See these pearls? Like a pearl, okay, of light. And look and see if they can see that pearl of light, and then talk to them in a hypnotic tone and get that light to see it grow and get larger and larger, and have that light surround them in a bubble of white light as a vehicle, right? A big bubble of white, effervescent, beautiful, luminous light, and get them to take that bubble and try to cross them into the light. Sometimes they don't want to do that. So then I say, well, what's your religious upbringing? Are you Catholic? What do you believe in? Do you believe in Mother Mary? Oftentimes I'll call on Mother Mary. Do you believe in angels? Is there somebody on the other side that you felt particularly attached to, that loved you, that you loved, that you would trust? Can you see them now and make eye contact with that person? And I always want them to make eye contact, because if they have another entity that's surrounding the situation, that might be a little nuisance entity, I like to call them, that just wants to cause some trouble. I don't want them connecting with the entity and then getting stuck somewhere else. I want to know that they've connected with either the eyes of the person, the angel, the being, or the light that can cross them gently into the light. Now, there are times when I've dealt with what I want to call really kind of evil entities, and those are rare, believe it or not. Most entities or attachments or spirit are usually loved ones or friends that get stuck here. They're dazed and confused. They don't want to cross over for whatever psychological reason, and they just don't go. But when you have a darker energy or entity like that, not only do you have to not be afraid of them, because you're in the light, right? You are working with Christ energy, Mother Mary, your angelic guides. Okay, as long as you are put yourself in the light, you're protected. Okay, so don't let that entity intimidate you, because they might say some nasty, ugly things to you. They might start swearing at you. They might rage at you. And then basically what I do is I try to talk them down. Okay. Like, anytime I've worked in a psych ward, part of the training was if somebody's, out of control, flipping out, whatever you want to call it. Okay. You have to talk them down so they don't hurt themselves, or you might have to put them in a hold until they calm down. But with an entity, you can't hold them, right? Not in a physical sense. However, I call on Archangel Michael to bring his lasso or his net of white light, and I literally envelop them. And Archangel Michael, if anybody's ever had an experience with an archangel, archangels are big, okay? They're intimidating, right? You don't want to mess with an archangel, especially one that's called Michael, because, that archangel sits on the right hand of the creator energy. Very powerful energy. But that angel will come in and literally scoop that entity up and cross him over into the light. Now, people say to me, well, isn't that kind of a little bit destructive? Aren't you like abusing the entity? Okay. Well, yes and no. However,
That's why you're there.
My primary goal is to release that person, my client, from the pain and suffering that this energy form has been causing them in their life. And if after releasing those energies or entities, that person's schizophrenic symptoms or their OCD or their suicidal ideation, whatever the diagnosis is, if that symptom profile dissipates, disappears, is desensitized, then I did my job. Okay. And that entity who crossed into light with Michael, trust me, when they cross over on the other side, they do a complete life review. The entity, they do this whole life review process. They basically desensitize the entity on the other side. And then, they plan the next lifetime. Okay. If the entity doesn't want to go into another body for another 1,000 years, so be it. They still have free will. Nobody's going to force you back into a body or an incarnation if you don't choose to do that, because you still have free will. And these are concepts that are alien in the psychotherapeutic community and in the medical community. However, any doctor who's been on an operating table and has had a patient die, and the patient floats up and out of their body and then sends them right back into their body, because, once you're out of your body, you can be in a state of nirvana. That's why people say, well, they crossed into the light. They talked to God. They talked to Jesus. They said, no, it's not your time. We're sending you back. They send you back into your body. Patient comes out. The doctors and nurses are like, oh my God, it's a miracle, right? Okay. Okay. And then the patient tells the doctor, the physician, the anesthesiologist exactly what the music was playing, if there was music playing, what the doctors were saying. Okay. Everything. How could they know that they were dead? They were dead. And what is that? That's what you call an NDE, or near-death experience of that spirit out of its body, but it still retains its consciousness. It has its memory. It sees everything. And how do you explain it? There are many doctors now who have had these experiences themselves where they've actually died. And then they've written a book about their near-death experience, okay? They're not crazy people. It's not woo-woo, okay? They had experiences that were very real, and they can prove a lot of what they experienced just by telling you what they heard the nurse or the doctor say. They didn't fabricate that. They didn't make that up. They were, dead.
Here.
So they were there. And I know I went through this with my father when I was 12. He had triple bypass heart surgery. He died on the operating table 3 times. Okay. From the neck up, God froze him and was saying to him, no, you have all these children. You have a family. You have to go back. You're needed. Okay. At 12 years old, my father was telling me of his near-death experience. And this was way before I knew that I was a psychic, that I had intuitive abilities, that I was this person. And so those experiences are very, very real. And I want people today to know that any of their loved ones, okay, who have died and have not crossed over, if you notice yourself or any of your children or anyone in your family becoming symptomatic with psychological disturbances, right? Hearing voices, seeing things, hallucinating things that are not there, talking to spirits, or you start having a physiological or psychological response, go get those people screened. Go get your children screened. Now, clear your house too, okay? Have someone come in and do spirit releasement therapy in the house. Clear the house. Now, the other thing I want to say is, in the Catholic Church, they have what's called exorcism, where they have a priest that goes into a home of a person who they feel, they call it possession. They're possessed by a demon. That's what they call it. Okay. And they go in to clear it. You may also notice in a church, when you go in and you see that instrument that they're weaving back and forth, right? They're walking up and down the aisle and all the smoke is blowing out. What do you think they're doing? Anybody have an idea?
Oh, it's sulfur. They're clearing. They're neutralizing the air.
Exactly, because
Yeah.
when people come in for the church for their sermons, they bring their entity attachments into church. And those
Makes
priests,
sense.
they know exactly what's happening. They may not tell you that's why they're doing it, but they are clearing the energies off of all those parishioners that come into that church, because they don't want to, they don't want those
They
people.
don't want it.
They don't want to have that on their energy field. The Catholic Church has known about this for many, many years, okay? But they call it exorcism and demon possession for whatever the reason. That's what they call it. But really, most shadowing or attachments are not demonic. Now, if you're a paranormal investigator and you go into, let's say, a prison where there's been a lot of violence and anger and rage, you are going to pick up energetically on spirits that are stuck there, that haven't gone into the light. Because most people in prison who have a prison sentence of a life sentence, they die there. It's like a hospital. They die there. So all their energy is left there. And if a person lived a bad life where they were a nasty person, do you think if they have a religious background that they're going to want to go to the light? They're going to think, oh, I'm going
I'm
to
going
hell.
to get in trouble.
I'm going to hell. I was a bad person. I killed 6 people, right? Okay. I mean, really? Do you think they're going to cooperate with a paranormal investigator that comes in and is like interested and intrigued by, entities or spirits or whatever you want to call it? Well, I worry about the paranormal investigator because once they leave, what happens if they have attachments on them? Okay. They need to get themselves cleared off. I spoke to somebody about the kind of work I did about a week ago, and he was really spooked about it. Okay. It was spooking him out because he couldn't understand it. Because in his mental processes over the course of his life, if he was, say, Catholic and brought up in a religious background, they have a certain terminology for these types of things. And people who talk to the dead, okay, are witches, okay, or we're doing woo-woo, all right. There's something wrong with us, and we're not taken seriously. But I have done hundreds of client hours with people that have come in with varying diagnoses, whether it's schizophrenia, multiple personality disorder, sexual abuse survivors, obsessive compulsive disorder, depression, anxiety, phobias, addictions. And every time I work with that person energetically, if I don't do this piece and make sure that it doesn't exist, I'm missing a whole part of psychotherapy that's going to help that person free them up so they can live a healthy, happier life. I'm doing them a disservice. And if I'm hiding behind my license because I'm being threatened that that's not, evidence-based psychotherapy, right? Then I am depriving that person of being well and whole, and coming back to that core self, that core soul that they are. And that is doing them a disservice. And that's doing my profession a disservice. And I can tell you, there are many psychotherapists that understand what I'm saying because they do this kind of therapy behind closed doors in their office, but they can't tell anybody because if they told people, they'd get fired. They'd lose their jobs.
They would lose their license.
They would lose their license, and their insurance company would surely not pay for that kind of treatment. Okay.
And it's too bad because that's a lot what's needed.
That's why I became
But
ordained.
if they get rid of them, they couldn't give you the drugs that they want to sell you too.
Exactly. But that is the sole purpose that I became an ordained minister, and why I have a PhD in spiritual counseling and metaphysics. Because I figured, well, you know what? Go ahead, take my license. I still have my hypnosis certifications. You can't take that from me. I'm still a minister. You can't take that from me. Okay. As long as I'm not, collecting payment from the insurance company, I can do what I do without a license. Now, do I want to do it without a license? No. But you know what? At this point where I am in my own spiritual development, if you have something that can help a person and you prevent them from having that information, then that's a sin against humanity and that person, and you should be ashamed of yourself.
I totally agree.
I understand if you're a psychiatrist and your job is to write a script for a person to deal with a symptom, fine. That's what your training is. That's your job. But you should still give them all the information and let that person, because they have free will, make their own decisions and their own choices. I am so tired of people all across the world in a stranglehold because of the APA and the AMA and pharmaceutical companies, okay, a stranglehold on preventing people from healing modalities that just because they can't make money from it because they don't have that background or training, right? They want to prevent the holistic community from giving people information to help them. And that's a sin against humanity. And those people will suffer karmic retribution at some point because they are not living an authentic, ethical, way when I went through my training, I took an oath to do no harm. Okay. I have to go through ethics training for my license every 2 years.
Me too.
I have to live by a moral code of conduct for my license as a psychotherapist. Okay. So if that is true, if that is the qualification for my license, then how can you prevent somebody from utilizing this higher consciousness of energy medicine, because this is energy medicine, to help them deal with this kind of energy attachment or shadowing? It really is not, it's not something that as a psychotherapist or a minister or a hypnotherapist, that is the right way to do by your patients. It's just wrong. And at some point in the future, and this is happening now because we are now in the age of Aquarius. And the age of Aquarius, and the age of Aquarius is we're going to be working for humanity in a group as a collective, outside the box, with maybe unorthodox means from a higher spiritual consciousness. And all this chaos and trauma that you see playing out right now on the planet, it's serving a purpose. Yes, well, a lot of people are acting out. Okay, just recently in Nashville, what happened yesterday? Some person went on a shooting spree and killed 3 children and 3 adults in a school setting. What do you think was wrong with that person? Do you think she just had a mental illness alone?
She had an attachment.
She probably had an attachment. What person in their right mind, who has their whole life ahead of them, even if they were upset or angry about something, okay, would have the wherewithal to do that kind of damage? And those poor souls, those children that died, those adults
They're
that died,
never going to forget that.
you understand, in that school, those kids that died, they're dazed, they're confused, they're hurt, they're angry, right? Whatever their emotions, their energy stamp, they're still stamped in their energy field with these psychological and emotional disturbances in their energy field. Do you think any of those children are going to know to cross into the light by themselves? Where are they going to go? Now, most of those children's parents were waiting outside for them, distraught. Was it my child that died today? So those children may be very aware that that parent or that patient was waiting for that outside, and they may go attached to that parent because that's where they felt safe the last time they were, if they knew what happened to them. Have you ever seen anybody that had a gunshot wound? You know, I was an EMT in the Army. That was where I first started with trauma at 18. I was an EMT in the United States Army. I went through all this training. Do you know what a gunshot wound does to a person's body? It's horrendous. Not only the force of the gunshot itself hit that poor child and sent them into this emotional energy stamp of, fear, panic, anxiety, which is in their energy field. And then in the next lifetime, if they reincarnate, guess what? They're going to have that issue.
Oh, wow.
And I know because I've seen this in adults who were in a womb when the mother experienced an issue and the kid never had any kind of traumatic event with that issue. And then 20, 30 years later, they start manifesting the symptom. Well, guess what? As soon as I hypnotize them back to the last time or place that occurred, they were like, oh my God, I was in my mother's womb and she was having this experience. Oh, it's not my energy stamp. It's my mother's issue that stamped me. It's the same thing with anybody of these children. And so if I was a psychotherapist, you know what they're going to do at that school? They're going to send a social worker like me into that school to talk to those kids to deal with their PTSD trauma, because everybody was traumatized, right? Okay. I don't know if they're going to do EMDR on those people that went through all that trauma, or if they're just going to go in and do cognitive behavioral talk therapy. And as we all know, that only can go so far because you have to desensitize the traumatic thought with emotion. What are they going to do with those children? that have been through that experience? Are they going to send
Give them
somebody
drugs.
yeah, exactly. Are they going to send somebody like me in there to just, clear the whole place?
They don't want you to fix it. They want to give them drugs for the next 20,
Well,
30, 40 years.
no,
For what happened.
it's even simpler than that. They're unaware that this type of therapeutic intervention actually exists because we've been prevented from sharing it with the population of the world. Because the AMA, the APA, and the pharmaceutical people, they have a stranglehold on psychotherapy, on medicine, and they know that if they cure the symptom that caused the problem, then they're going to be out of business. They're not going to make that money. Okay? It's the same thing with dealing with the NRA and Congress, right? Congress knows they need to ban these assault weapons. Who the hell needs an assault weapon unless you're in a war zone? And as an ex-Army medic who fired an M16, I can tell you, you don't need an assault rifle. And you shouldn't have one unless you're in a war zone. Or you're a police officer who needs to protect themselves from the idiots out there in the streets who have assault rifles, right? So the laws have to be changed, and no more funding from the NRA to Congress so they can get reelected.
Lobbyists.
Because people like me, I turn on the TV and I go, oh, another shooting. How many more people do I have to treat in my office that have to experience this kind of trauma for no reason? So yeah, I get angry about it because I'm the one who ends up having to see it and treat it and know it could be prevented. They make us wear seatbelts. They stop putting cigarette commercials on television because it causes what? Lung cancer. Okay. They make you get a driver's license and you have to go through tests. You even have to get a marriage license to get married. Okay. Why do you get an assault rifle? How does that happen? These laws are
I
things
believe a lot of people have got assault rifles because they're always worried that the government is going to come after them, and everybody wants to have something to protect themselves.
Oh, you know what? That's such a load of crap because anybody who can qualify for a handgun or a rifle can go out and get it in America because that's your freedom. But an assault rifle is not a necessary protective means. It's unnecessary. Any of those other type of weapons will do the trick. Okay. That's just an excuse so that they don't have to change the laws and stop getting money to take care of their re-elections. Okay. It's all political crap at the expense of our children and our teachers and our psychotherapists who then have to go in and deal with all the trauma. And we're expected then to make it all go away magically. It doesn't happen that way. And then you've prevented a child from having a life. So now as a part of how do you know if a person has crossed over into the light, the entity, how do you know if the spirit has crossed over into the light? And how do you know if the person or the client that you're treating is symptom-free? Well, you do follow-up session with your client and see what their symptom presentation is. If they're schizophrenia, if they're OCD, if they're anxiety, if they're phobia, if they're depression, if they're suicidal ideation, okay, if that has gone and not has come back over several weeks to several months, and believe you when I tell you, I follow up with my clients months later because maybe I missed something, right? Okay. I'm not a perfect psychotherapist. I miss things. Okay. So I'm going to follow up with that person. If they're symptomatic and free after 3 months, unless they got into another situation where they were in, a hospital setting for a surgery, say, and then they started getting symptomatic again because an entity attached to them that died and it went across from the light after their surgery, that's another story. But if the general symptom presentation that they presented themselves with in my sessions and originally is gone, they're good to go. Now, as far as the entity goes, okay, one time when I was a young and green psychotherapist that did spirit releasement therapy out in the Southwest, when I was going through my hypnosis training, I actually pushed the spirit out into the lawn. Okay. I didn't cross it over into the light. So what I had to do was call my colleague who was a minister back in Chicago, and he's still alive. His name is Don Hood. He probably still does spirit releasement therapy in the Chicago area, unless he retired and is no longer working. But he's also an ordained minister. He and his wife, who was a psychic and one of my best friends, Sherry Hood, they checked to see what happened to the spirit. And they're like, Renae, you crossed him into the lawn. By the way, not only did we cross him into the light, but there were 2 other entities. Okay.
That went too.
There were like 3 of them all total. But here's the magic about all this. When I went to Santa Fe, I went there with the idea that I was interviewing for a licensed clinical social worker position. But my friend Sherry said, well, you're going to go, but that's not the reason you're going to go to be there. She said, you're probably not going to take the job, but you're going to meet somebody and things are going to happen and it's going to help you with your work. I'm like, okay. She had been right about many things before. So I do the interview. I'm talking to the woman doing the interview. And, I said, I don't know if this is the right fit for me. And I said, I'm not sure that I want to do this. I said, but I need a place to live. I said, do you know anybody who is looking to just rent out a room in their home temporarily until I can get myself situated? She goes, well, I have a room. She goes, but I don't know if you're going to want to live there. I said, why is that? She said, because I've been having some experiences in my home that I'm not sure that you want to deal with. I said, really? What's that? Now, before she started to tell me that story, the day before, because I'm an ex-Army person, I was camping out on a campground in 30-degree weather in a tent, of all things. Okay. For the night before my interview, because I didn't have the money to spend in a hotel. So that night, I had this vision in a dream of this man, a white male, with a dog that looked like a German Shepherd, okay, that came to me, pleading for me, asking me for help. And I woke up and I was like, what is this, right? I and of course, a lot of us have these kinds of dreams and we don't understand them. Next day, I'm talking to this woman about a room in her house. She tells me about this man, this white male that comes in the night and he hovers over top of her. Okay. About 3:00 every night, same time. He's, if anything, he's consistent. And he just hovers over her body and he looks at her. He doesn't say or do anything weird. She goes in and she takes a bath. Her bathtub starts filling up with blood. It's not her blood. She's not shaving her legs. She hasn't cut herself. Okay. This happens on a regular basis. She does a little research. She finds there's a man that was in that house that committed suicide in that tub. Her dog was the same dog I saw in the vision the night before. And she said, my dog, ever since I moved in here, started acting different. He wasn't the same dog. Okay. And animals, as you well know, if you have animals, they can see spirits. They'll start barking. My pug used to bark at the door. Okay. Because, when my partner, Dr. Ken, died, he actually came to visit. I didn't know he had died. Snuggle started backing up at the door like he used to do, because that's how they used to play with each other. I'm like, what's going on? A couple minutes later, I get a phone call from one of Ken's patients. Hey, Renae, did you hear that Dr. Ken died? Okay. So these experiences, they're real. I've had them myself. Okay. If I didn't have these myself, with the hundreds of hours that I treated clients that have these, I would have never believed this. I would have never done this work. But when you have these experiences, they're so profound that they're so real. They're as real as me pinching my own hand. Okay. So that spirit, when I had crossed him out in on the lawn, and Sherry and Dawn then crossed him and the other entity light. Do you know that dog started acting normal, like its normal self again? The woman was so happy. Okay, she let me stay there for as long as I needed to until I could get a job and get myself situated and open up another practice and start my hypnosis, training. Right? She was so grateful because she didn't have to deal with the spirit hovering over her every night at 3 a.m. trying to get her attention. He came to me in the vision the night before. How did he know to come to me the night before my interview with that woman? Why? Because of the collective consciousness. We're all connected with this conscious energy. We all come from that same spark of divinity, that consciousness. That's how, when you're a medium and you're doing a reading, you're tapping into that divinity, that consciousness, that energy system, that one day there will be a whole paradigm. I might even write a whole program for psychotherapists myself to educate them about this. And if they don't want to teach this as a part of your internship or your master's program, so be it. Come and take it in one of my seminars. I don't care. I don't care how you learn it. But if you understand it, then you'll be able to help more patients. And this book is very, 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 very important. Okay. And anybody who might be watching this, who is a psychotherapist or a doctor or a psychiatrist or a minister or anybody who's interested in getting a clinical perspective, this book is by Winifred Blake Lucas. She was a PhD. This is volume 2. It's regression therapy, and I'll read it to you. It's a volume 2, special instances of altered state work. It goes into prenatal, birth, childbirth, child abuse, interlife, that's lifetimes between lifetimes, dialogue with an unborn soul, entity releasement, which is spirit releasement therapy, death, dying, and the dead, and the future. Okay.
And what is the title of that book? You've got the name.
It's called Regression Therapy, A Handbook for Professionals, Volume 2. I also have Volume 1, Past Life Therapy. Okay, because when I was going through my hypnosis training, I went through regression therapy and I did past life therapy training. And this book is by the same author, Volume 2. And do you see all the PhDs and the MAs and the DOs? An osteopathic doctor, okay? And another MD. Do you think those people with all that background in clinical training would attach their own names to these types of books and this material if they didn't have clinical expertise and history working with their clients in these areas? Okay. So see, these books exist. And I know we want to take questions too.
Yeah, I have a few good ones about past life experience.
This is Dr. Brian Weiss. He's an MD psychiatrist. This book is Same Soul, Many Bodies. His first book was Many Lives, Many Masters. When I was going through my hypnosis training in Santa Fe, New Mexico, and I was doing sessions with my own clients in a private practice setting, okay, I was doing regression hypnosis, past life therapy with my clients and regressing them back to past lives and future lives, I might add, okay, which is another topic for another time. But he's written many of these books. And when he was working with this one client, I think her name was Caroline, I want to say, she came in with a symptom of chronic migraine headaches. She had been to numerous doctors. She had had different therapies. She'd been to psychiatrists. They put her on drugs, blah, 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 right? She couldn't get rid of these migraine headaches. and I believe she was in her 30s when he treated her, Dr. Weiss. He regressed her to the first time or the last time that she had this symptom of migraine headaches. He regressed her through his induction, okay? And she went there from her higher consciousness. He didn't tell her to go there. Her higher self, her subconscious mind took her there. It knew exactly where the initial emotional energy stamp or the sensitizing event, which I wrote about in my first and my second book that's soon to be distributed and published, that he found why she had migraine headaches. She was living in an Arctic climate many millennia, hundreds of years ago, where she was wounded and killed with an axe in the head in the exact area where she used to get her migraines. Okay.
Oh my
And it's
gosh.
still there.
And she could not get rid of these migraines. And he went in literally with hypnosis and he desensitized that event, that trauma, and moved her through it, through the lifetime, through the death to her next lifetime. Okay. Because she had some other issues. This is why I like EMDR and this is why I like hypnosis, because you in EMDR, in the frontal cortex here of the brain, where your columnar cells sit, okay, that's where you get stamped with the thought of the initial sensitizing event. But with and with that, as you're doing the EMDR protocol in front of the eyes, you're working on this part of the frontal cortex of the brain, and you're literally having the memories from whatever time or place that had to do with that issue, that initial sensitizing event, like a set of dominoes falling down. Desensitize. I've worked with people for an issue in a current lifetime, this lifetime. The next thing I know, they're going back into another time, another place, a different lifetime. Same thing with hypnosis. I start to desensitize the issue and I check, okay, no, is there another time or place that this issue held a particular, feeling or thought? Next thing I know, their subconscious mind, their higher self, whatever you want to call it, is going right back. It could be 3,000 years in the past. It goes back to that event that has to do with that energy. And it starts to desensitize it as if it never happened. And I'm just doing what they call like shape shifting the energy. The Native Americans, they have shaman or medicine people, and they have certain dances and mantras that they use, and they shape shift. They literally can shape shift the energy around them. It's the same thing that I've been doing for many years with my clients, whether I want to call it compassionate, higher consciousness, energy medicine, whether I want to call it hypnosis, whether I want to call it EMDR, it doesn't matter. It's all the same energetic vibrational frequency of that higher dimension of consciousness that we all can tap into at each and every moment at will. This is how powerful humans are. But we have been told that we're not, that we need to take this drug. Okay. Now, if you're a heart patient and you have a specific drug that your doctor prescribes, yes, physiologically, you need to take that drug.
Like insulin.
Exactly, a diabetic. However, what caused those diseases in the first place? Some diseases, well, what caused it in the first place? I've had people come to me with medical conditions. I've worked with oncology patients with cancer. Okay, I've worked with people that had medical conditions, psychological conditions, immune system conditions. Okay. And as soon as I regress them back to the initial sensitizing event where that symptom began its origin organically, guess what? Then I have a way to have that desensitized, erased, whatever you want to call it. I can't use the word cure because they'll take my license from me, right? But it's not me doing the cure. It's the energy of the consciousness of that person in agreement with me as the team to shift that energy and eliminate it as if it had never occurred. And how does that happen? Do you think I'm a magician and I waved my magic wand and it just disappeared? I wish I was David Copperfield. I'd be that powerful, right? I'm just using divine consciousness, the energy that we were given as our divine birthright. But it's been deprived for so many years because of people who make money, okay, and don't have open minds. They're not flexible in their learning processes. So they miss all these wonderful healing modalities. When I worked at Loyola, I was working for 3 years in autologous bone marrow transplant. I worked for Dr. Patrick Stiff, the top oncologist. He's probably still there in Maywood at Loyola at the Cardinal Bernardine Cancer Center. He used to yell that we kill 50% of all our cancer patients, whether they've had a stem cell transplant or not, right? Now, do you think if I would have told him any of these things that I was doing in my private practice as a psychotherapist, that he would have listened to me? No. But you know what I was doing while I worked that full-time job? I was serving on the Loyola Complementary Alternative Medicine Committee, where we hired a doctor who was not only an MD, but an acupuncturist. And then we hired a Reiki person and a chiropractor, right?
Nice.
And they started integrating holistic energy medicine into their dynamic. Why? Because the American public said, you know what? We know there's other things out there that work. And so what they started doing was, instead of taking pills, right? They started doing holistic modalities for healing whatever their issue was. And so the Western trained modern medicine, they want to get in on it so they can get a piece of the action. Okay. Now, I'm not saying that the Jesuits at Loyola, that their mission and their purpose isn't to help people. Okay. But if you do any kind of research about who the Jesuits really were, okay, they weren't very nice people. Right. However, we have to shift with the times. And the consciousness and the paradigm in the new age of Aquarius is of love and compassion. So when I'm working with my clients, in particular, these entity attachments or spirits that are discarnate and can't, for whatever reason, decide that they want to give up their free will and go into the light, I have to work with them from a place of love and compassion, just like I would a real person in a body. Because when you do that from that energetic frequency, that entity, they start to remember who they are. They go back into their divine original blueprint, the loving being that the creator put in their body before they came into the lifetime that got so messed up because of whatever life, caused them, right? Whatever traumas. And once I connect them back with that heart center, then I've got them. And then I can actually work with them. And I rather not use Archangel Michael and pull them into the light in a negative way, because guess what? I want to get their psyche in this different mindset, in this love energy, so that when they go into the next stage of their soul's evolution, it's not such a struggle. Because sometimes when they put you back into another body and you incarnate, for whatever reasons, for whatever lessons you want to teach, learn, or grow through, they might not always clear these old things, these old thought paradigms that you came in with. So then in the next lifetime, you're still dealing with the same crap, right? So why not treat the entity or the spirit just as much as you would treat the person that came in a body?
Makes
And see,
sense.
this is my mindset from many years of working with these types of issues. This is not something they're going to teach you when you go through your master's program or your PhD program. You've
Right.
got to seek this out. It's thinking outside of the box. But if you don't have an open mind, right, you're not going to pursue these other avenues of thought. And one day, energy medicine of the future is going to be all of this kind of self-healing. They're going to figure out how you can heal the self, mind, body, and spirit. And there won't be any kind of drugs that you have to put on like a Band-Aid that aren't going to deal with the original problem. Okay. And I would never tell a patient to go off their drugs, okay, without consulting with their doctor or their psychiatrist, because you still have to wean somebody off of a drug because it's in their system, their bloodstream. You know, they'll have a reaction, and you don't want to throw them into a healing crisis, right? You don't want a cathartic event. You want them to, you know, slowly come off of those pills or that medicine, if at all possible. And one final thing, because I know we're going to do some questions here.
Yeah.
When I was at Loyola in the Department of Psychiatry, I would have the psychiatrist say to me, "What are you doing with the patients? They're going off their drugs. They're not symptomatic." Okay. Well, I was doing this work behind closed doors. Thank God none of my patients ever told anybody in management that I was doing this stuff, or they would have fired me. Okay. But
Hey,
because,
we're losing money. She's getting.
well, but it's not just money. It's about power and control. Okay. Those people who are at the top of those institutions, they have a lot of power. Okay. Those are the kind of people that hire your congressmen and your senators to do what they want them to do, right? Back in the days of Lyndon B. Johnson, I'm dating myself, sorry, but this is who I am. Okay. That's when all the pharmaceutical companies were given free reign to come in and do their thing. They literally came in and took over. And that's why every other commercial on television these days is a pharmaceutical commercial. Okay.
With 10 pages of after effects that happen when you take them.
Exactly. And do you know that every medication that you, in an organ system in your body, primarily your liver, your colon is your second brain. So when you're putting those drugs into your system, those organ systems have to process it. It's like a toxic factory in the body. Okay. You think those 15 drugs that you put your father on, who has Alzheimer's or dementia, do you think that he's not out of it most of the day? And why is he out of it? Now, if they put him in a hyperbaric chamber, right, and cleared all the brain fog and the candida and yeast in his colon, okay, and had his brain start working again, he wouldn't need the drugs. But because they can't make money and they can't have power and control, they just keep telling the public, "Oh, this is what you need." And these other things are woo-woo and voodoo, and they're not evidence-based medicine. Well, if you read my first book, you will see all the scientific and the physics and the psychobioneuroimmunology and the biochemistry, including my intuitive abilities and my psychotherapeutic background and my hypnosis. You'll see that I've referenced things in that book from people who have more education than I do, okay, that can tell you that these types of holistic, and really they shouldn't be called holistic, because I think these are metaphysical. These are metaphysical, science and spirituality blended together, paradigms, the new age, the new consciousness, metaphysical paradigms that are going to help people heal themselves. They need to change terminology. I think they should take the word mental health and throw it in the trash can.
Agree.
That connotation puts stigma on people and prevents them from seeking help.
Any help?
It prevents them from seeking help. 22 veterans a day in my country, our country, suicide out because they come back from war trauma with PTSD and guess what else? Entity attachments from their combat colleagues that have died in a war zone. And why? Because they don't train the psychotherapists at the VA to treat these conditions, because they have no clue that they actually exist, because there's no terminology in the system to not only define the terminology, but to explain what it is, how it works, and how to, facilitate that process. Okay, so There's so much more I could cover, but we have another couple 15 minutes. So whoever has
Yeah,
questions, please.
I
Please.
have one question I definitely want to get up. And that was from Kimberly Horn, and I'll read it. I have a very deep question. I had a past life regression, which took me into life where I died, but I was very confused and didn't realize I had died. So my question is, first, here I am now. That energy or part of my spirit, is it stuck and didn't move on? Is it fragmented? Is it part of me out there haunting that area where I died in a past life? And if so, if someone crosses that part of my fragmented soul, what happens to my living soul in this life if that happened?
Okay. And this is why I tell you this subject matter is very complex. So if she's my client, I'm hearing what she's telling me. I'm going to break each piece down and I'm going to address each piece, each question until I find the answer to her question, because there is so much there. How do I know where it came from? Right? How do I know if the entity is still not attached to her? And is it from that past life? And what past life was that? And what happened to that spirit that died in that lifetime that made it not cross into the light? How can I talk to it to see, okay, what happened? What's its belief system? Can I get it into agreement to cross it into the light? And then I have to check, are there other entities attached to that entity? I mean, it's like a domino effect. This is why when you come in, it's kind of like complicated bereavement. Spirit releasement is complicated spirit releasement therapy. I have to dissect that person until I get every piece and make sure I've scanned the body and gotten it all away and made sure I crossed each one of those entities into the light. Well, guess what? How many sessions is that going to take? I don't know. I don't know until I start working with that patient or that client. Until I do my hypnosis regression to those specific incidences that she has said are her issues, I won't know until I get there. It's like a surgeon, okay, who's going in for a surgery, who's never done it before. They're going in blind, right? And once they get in there, because of their expertise and experience and maybe their tools that they're using, they go, oh, okay, I see what the problem is. I know how to fix it, right? These days
But you
in
got to get
surgery,
there.
right? These days in surgery, what surgeons now do is they send a camera in with a little tool on the end of it that can clip things off, right? Because they've gotten more precise. Well, that's what hypnosis or EMDR or what I do does. I have gotten more and more precise over the years because I've learned that I have to do certain things to make sure I get every little piece as much as I can and clear it, and do that body scan several times to make sure I have gotten everything. Then, if she's asymptomatic after several weeks to several months, then I know I got everything. And she knows she got everything. But she's not going to know that until she starts to feel different. Now, when I'm doing hypnosis or regression, I do such deep inductions that I will do what's called suggestibility testing so that that client knows that they're actually in trance, because I don't want them thinking that, number one, they're not in trance deep enough, okay, that whatever they're seeing or feeling or experiencing, that isn't real. Because guess what? I don't care if they go back to 1800s or 1977. I don't care what they're seeing. It's not so much the scene, it's the energy of that emotion, of that event, that I have to help them work through psychotherapeutically, energetically, on many levels. I'm working with the psychology, the physiology, the energy field, the entity, whatever the issue was. Okay. I could be dealing with a person with multiple personality disorders who's been sexually abused since the time she was 2 up until the time she was 35. Okay. And she could have numerous entity attachments from the people who molested her, okay, from their energy that she holds in her body. So until I get in there and start doing my surgical work, I'm not going to know until I get in there. And then, of course, like I said, I'll make sure everything's cleared. That was a very good question. Thank you for that question.
Kim.
Whoever the viewer was, Kimberly.
It was Kimberly
Yes.
Horn, yeah.
But what I would say to you, Kimberly, is if you're still experiencing those symptoms, go find somebody who knows what they're doing and help you move through that and get that cleared. Okay. Because you shouldn't have to suffer with that in your mind, because that is anxiety producing in and of itself. All those.
Well, she was pretty much just wondering if her life would, if she didn't know she died and she's still earthbound, would she still be in that spot wherever she was that she died? Where, even though she's living now, is that possible? Do you think that's possible?
You mean a spirit would be in this spot where
Yeah,
she
if
died?
she could be in two places at once.
Well, okay. In the laws of physics, they say there are more than 13 dimensions that we exist in a physical body. You and I are in 13 different bodies and different dimensional frequencies, right? Okay. So, and because time technically doesn't exist anywhere except here, which it really doesn't even exist here. It's just a construct that we put on it so we can track things, right? Okay.
Right.
Yes, very much it could still exist right now. But unless she has a paranormal investigator go in there that can take their equipment, because they have equipment now.
She is a
right?
paranormal investigator, actually. She literally is.
Right. So if she detects there's something still there, then there probably is. And maybe she wants to take somebody in there to clear the energy. I mean, she could do that herself. Just go buy yourself some sage or sweetgrass in a little bowl and set it on fire, with the smoke, and ask for love and light. Only those of a higher light, love and light. You can ask for Archangel Michael. You can ask for Mother Mary, Jesus Christ, whoever your higher guides are, your angelic realm. Ask them to please cross the spirit over into the light with love, always with love. Okay. Try not to force them over, but that's a very good question. Thank you very much. Okay. Who's this next? Greg?
This is Greg Koss, another one of our spiritual brothers. Hello, Renee. One of
my father. I see it. One of my past lives, I crossed paths with my father in the Pacific off Okinawa in 45. Is this highly uncommon? No, absolutely not. Because as I said, was he a war veteran, by the way? Was he a war veteran?
Yes, Greg is.
Because I'm picking up war veteran. Okay. So if he felt like he didn't want to cross over for whatever reason, he was traumatized, maybe he was dazed and confused. I don't know how he was killed. It could have been a shrapnel wound, and it could have been a tank injury. I don't know. It could have been accidental. He could have even been shot by friendly fire. Whatever the reason, I'm getting military. Okay. That person was traumatized. And if he decided that he wasn't ready or didn't cross over, or for whatever reason, he could still be attached to you, Greg. Okay. If you've become symptomatic and you start acting like your father, maybe you got symptomatic with some of his issues, or maybe you just feel him around you all the time, or maybe you'll notice certain things like the lights flash in the room, or objects get missed, or you hear certain music, or you have a smell of a scent of his, or he may be trying to get your attention for some reason. Okay. Maybe you can have a medium do a reading, find out what it is he wants. Maybe he's trapped here and he can't cross into the light for whatever reason. Well, maybe we should talk to him and see why he's stuck. What is making him stay here? Is there something going on in your life, Greg, that he feels he needs to protect you and watch over you? Because oftentimes spirit won't leave too. They want to stay and watch their children grow up. They might want to be protective. They may not go for many, many, many years. People think when you die, you cross right over into the light. No. You can stay for as long as you feel you need to watch over a family member. That's why when kids say, "Oh, mommy, I have this," what do they call him?
Invisible friend.
That's right. And, well, that could have been your grandmother. She's protecting her granddaughter. Okay. They're not there to hurt them. They're not dark or negative. They're just watching over them. They're like, they're angels in a sense, right? And they will only go when they feel like they're not needed or it's not required anymore. But that was a really good question. Actually, when I treated Vietnam veterans. I used to do some group work with Vietnam veterans.
Greg is a Vietnam veteran.
Okay. Well, I actually lived with one for a couple of years while I was going through my master's program. The guy was an addict. He was addicted to alcohol. He was a forward observer. He would go pick up the bodies in Vietnam. It's like, can you imagine having to go through that? And you're 18, okay? That poor guy, he drank. He'd work a daytime job, and he'd be in a bar from the time he got off of work, because he was like an engineer and at NYU. He'd drink the whole night because he couldn't go to sleep at night without having night terrors and flashbacks from the PTSD from all the bodies that he had to take care of, right? And he was a screaming eagle. He used to jump out of helicopters, right? So, and I lived with that person when I was going through my master's program, and I said I had to go to see a therapist with him. And the therapist was a Vietnam vet, right? And he said, Renae, he goes, you're in your master's program. Do you think that Ray is going to give this addiction up without dealing with his PTSD trauma? And I said, no, you're absolutely right. He's not. Ray wouldn't go and get help. So guess what Renae had to do? Right? Because it's not my job to fix you. It's my job to give you information, and then you have to be willing to go and do the work. And I can tell you, all these veterans who are killing themselves, right, every day, they've got PTSD trauma, and they are not being treated properly. The VA is not treating these veterans properly. Most of these veterans are going on horse farms, okay, and doing horse therapy, right? Because they're getting love from the animal who makes them feel safe, when they really should be in a session with somebody like me doing EMDR and hypnosis and maybe checking for entities, okay, to release them from these flashbacks, these night terrors, these addictions that they don't need to struggle with. But until I can get into the VA and change that system by educating the people who work with veterans are still going to struggle. And most veterans don't want to go to the VA because they don't trust the government, because of what happened to them in Vietnam. And I don't blame them. They have every right to feel that way. They have every right to feel that way. Okay. But as a veteran myself, okay, to me, I understand, not from what they went through physically and psychologically, because I didn't live it myself, but because of what I do, I get their trauma, and I know how to tell them to get it fixed. But the problem is, if they don't go to an EMDR trained therapist, right, and there's hundreds of them all over the world, all you have to do is go on the EMDR.Institute.org, and whatever specific state or country that you live in, you should be able to find an EMDR trained therapist who has gone through the protocol, EMDR 1 and EMDR 2, and they have the certification. And they've usually had to treat 50 to 100 clients in the first protocol before they can get into the second protocol. So they're seasoned and they have experience. So that was my little bit there, because I think it's really important for people to know that anybody who's suffering with PTSD, go into the EMDRinstitute.org. It's Dr. Francine Shapiro. I think she's died. I think she died a couple of years ago, but her whole company, her agency, they're still in existence. They're still training therapists. It's a really valid therapy for anybody who's been through any kind of trauma, sexual assault, sexual abuse, police violence, shootings, okay, physical abuse, domestic violence cases, alien abduction cases, all right? Anything like that, PTSD related, EMDR is my psychotherapeutic choice as a tool and an intervention, and I will utilize it along with hypnotherapy, because I think the two together have different types of benefits for the patient or the client. And if you have a seasoned therapist who has those skill sets, then you've probably won the lottery, and you're going to get a lot of help. Okay, a next question. Is there another question?
Yeah, Jeff had one. If you could put that back up there, please.
Yeah.
Jeff does suffer from post-traumatic stress.
Yeah, his was a question more about the
I
smoke,
see it.
about
When
when
you're in
you
a
are in
church,
the church.
a deliverance more than exorcism. That's a really interesting term that you use, deliverance. An exorcism, by definition, is getting rid of a demon and energy. A deliverance, as far as the definition, is you're delivering something, right? Like you're delivering something somewhere. So when you're doing spirit releasement therapy, okay, at least from my experience, I am essentially delivering that spirit into the light. In that church, though, where are those entities going? Think about it. The smoke is blowing, right? Okay. Do you have any idea how many entities you're
Just
releasing?
sending them off.
You're sending them
Not
all
sending
throughout.
them anywhere, just wherever.
You're sending them all throughout that church. Okay. All right. So is the smoke from that thing, what do they call it? Callus of some sort? I forget.
I can't remember what it's called.
I'm having a brain fart, so I don't have it. I don't have the word, but that smoke, right, is just blowing those entities around. Okay. Now, the Native Americans, right, use smudge and sage, but they usually, this is how they've taught me to do it because I was on the reservations. When you're in your house or an enclosed space and you're smudging, not only do you smudge the whole house, including the closets and the cabinets, you really have to open everything up because entities can hide in the corners and everywhere, right? You smoke the entire house and you say, only those of love and light are allowed in my presence. That's what I say. I'm easy. Then you open up the doors and the windows, okay?
Let them out.
And you let them out. Now, where are they going to go? Wherever they want, right? But I'd rather not have them in my home when my
Not here.
Okay, I don't want to have to deal with that because I'm a positive human being. I don't want the drama and negativity in my life. There's enough crap going on the planet today that's chaotic, that is traumatizing people. I don't need the extra, right? That's a really good question. And that's the best I can answer to the best of my experience. But thank you. I like that question. I never had that question before as far as deliverance. I think that's really cool. So who's this? Greg. Thank you very much.
That's Greg.
Yeah. And also Linda had mentioned something as well. Linda.
What does she want?
Let's go back.
Let's see.
And one final thing, okay? I don't know if there's any doctors or nurses or psychotherapists or Reiki masters, massage therapists, whoever is watching this, or paranormal investigators.
Yes,
okay?
there are.
If you can, go get that book. Go buy volume 1 and 2. Educate yourself, okay? Because invariably in your profession, at some point, you're going to come across a person who is symptomatic. And if you have this in your bag of magic tricks, okay, you'll be going, oh man, I remember when Dr.Renae was doing this talk, and I read this book she told me to read, right? And it's like, oh my God, maybe I can help this person. And I know for a fact, Lynn, that you shared a story with me that you were able to help a person with entities attached to them while they were in the hospital setting, which is pretty standard, right?
Yes.
It's pretty standard operating procedure in a hospital that if you go in for any kind of procedure, you may actually walk out with an entity attachment. Okay, so this is Linda. Well, there does come a time when a person's free will chooses not to become well. Well, yeah. We as healers can run across people who will not let themselves heal. This is part of their lesson that they're here on earth to learn. We cannot interfere with their will. Well, okay. I beg to differ with that. And I think I covered that, but I'll cover it really briefly. Okay. Yes, while the entity has free will, you can still work psychotherapeutically and find out why they don't want to do it. Why did they die? How did they die? What is their perception of their religious perception? Okay. Like, what do they believe? What's their religious belief system? And then therapeutically talk to them with love do an assessment, okay, and find out the rationale and the reasons why. I guarantee you'll be able to move that little button on that barometer forward and even do that little pearl of light thing that I taught you, right? Have them imagine in their solar plexus a pearl, an effervescent pearl, and see that pearl light expanding, coming out through their solar plexus and surrounding them in a ball of light 3 feet all around them, and actually have them feel like they're floating inside this orb of light, this luminescence that is a vehicle that can travel them forward and backward in time or space, and have them see that light expanding and traveling down a road, the road of souls, traveling down the road of souls. Do you see how I do, imagination, visualization, right? That's a part of the work, right? Visualize, imagine. And then when they start to see that light grow, guess what? You've got them, because they're going to remember that they're of the light. They forgot. The word remember is RE-member. They're remembering they are of the light. And once they start to remember they are of the light, you've got them, and there's no force. But if you don't know the protocol, the right questions to ask, therapeutically how to work with them, you're never going to get them there. That's why I did this whole talk tonight, right? Because I'm trying to educate people of how to do this. And that's why I said, go buy the books if you can. Read how they do it. I can guarantee you in those books, these steps are broken down step by step. They even do case examples of a lot of different kinds of entity attachments. Okay, I see my hair is all over the place. And you will learn. Teach yourself. They're not going to teach you this in nursing school.
No, that's true.
They're not going to teach you this in your psychotherapy school.
No.
Medical doctors, they're not going to teach you unless you have a metaphysical or holistic background, okay? There was a doctor, I believe his name is Dr. Larry Dawsey. He did a lot of work with near-death experiences, okay? You could just Google near-death experiences on Amazon.com, and you will come up with a wealth of people who have written books that are medical doctors, PhDs, well-educated people, okay, who have lived with this with their patients and their clients, right? And that's one of the reasons why I'm talking about it today. With everything that's going on. I've
experienced a few.
Well, yeah.
I've had a few NDs.
And with everything that's going on, our planet now is going from Pisces into Aquarius. And it's going to be in this for till 2044. Aquarius is the age of enlightenment. If you do your history and your research, you will find that the age of Aquarius happened during the days of the American Revolution. Okay. When the United States was formed, and many other historical occasions were the age of Aquarius, because it's a cycle, it circles around, it comes back every how many years, right? You will see, and in those times, you will see the period of the Renaissance, okay, the age of enlightenment. These were all during the Aquarian ages. That's what they're meant for. They're meant to enlighten people and give you information of a new higher paradigm of consciousness, because the paradigm of consciousness that the planet is in right now is chaos.
Mm-hmm.
It's chaos. I grew up in the 60s, okay? So guess what? What were the 60s about? They were about peace signs.
Peace.
Everything was groovy. It was about love and harmony, okay?
Love who you're with.
But all the while, we were sending our sons and daughters to Vietnam to be slaughtered, basically. For what? For what? So look, the age of Aquarius is everybody's chance to go in and take personal responsibility, to live your true potential, to do the inner work, whether it is, depression, suicide, anxiety, OCD.
Taking responsibility for themselves.
Because it's personal responsibility. But if you have information, remember, information is power. Knowledge is power. The people who are in power don't want to give us information because as sovereign beings on this planet, it's our divine birthright to have free will. But if they deprive us of information and then knowledge, how can we live a full, productive life as a sovereign being? And when people are spiritually so disintegrated because of all these chaotic, creative, these chaotic things that are going on the planet right now, guess what happens? It's a distraction, and it stamps your energy field with more PTSD trauma on top of the PTSD trauma you already have.
Be afraid.
Be afraid.
Scare you. Be afraid.
Factor, fear, uncertainty, and doubt. Let's keep them right walking on eggshells. Let's distract them, because the more we distract them, the more power we can hold on to, and we're in control. And guess what? The age of Aquarius is not about control. It's about working as
let it go.
Collective consciousness. It's a collective consciousness. It's working together for the benefit of humanity. That's what the age of Aquarius means.
So for the greatest good.
Exactly. And my purpose on this planet is, until the day I cross over, make my transition, I'm going to do what I came here to do. I'm going to be the librarian, is what they call me on the other side, right? I'm going to download as much information as I can and enlighten you, everybody out there. Don't believe what I say. Do the research. Look up the stuff I'm talking to you about, okay? I'm just sharing it because this has been my work, my life's work. This has been my entire life's work. My experience from the time I was 12 when my father had his near-death experience. I've been just adding to my little bag of tricks.
To the puzzle.
Yes, exactly. Adding pieces to the puzzle.
It's adding pieces to the puzzle. It's the title of this program, right?
Yes.
Okay,
yes,
so we're probably going to wrap it up for tonight. But
yes, we are.
Definitely.
Actually, Renae, would you like to tell people how they can find you?
Yes.
Well, you can always find me on Facebook. You can friend me. You can DM me. You can also write to me through my email.
You can reach out to us too, and we can transfer any messages over as well.
Right. You can write to me through my email. I think you have all that information, right? You can put that out for me. Okay.
Yes, we can. We can post it after.
I don't give my phone numbers out unless you're actually one of my clients and I'm going to do a reading or I'm doing a therapeutic session, because my phone will be ringing off the hook with people like, telling me all their problems, which I know are important to them. Right. But I'd never get anything else done.
That's true. Okay. That's true.
And that's kind of how that works. But anyway, and then my next book, I'm working with my publisher now. The manuscript is almost done. And I don't know if you have the title of that book, but the title of that book
is,
and I have to get it right.
Isn't it EMDR?
Yeah, hold on. Okay. It's going to be called EMDR, Therapy to Transmute Trauma Through Love, a New Consciousness Paradigm. And I'm going to have it distributed in a soft cover, ebook, Kindle versions. And then I'm going to be putting on an audio version down the line because I want to narrate it myself so that the meaning behind the words of the book come out exactly the way I was instructed for them to come out. Because even though I might be putting in a wealth of all my years' expertise and experience, I still am channeling information from my guides, my angelic realm, my higher self that are saying, no, you forgot this piece. Okay. And here's why it has to go in. And here's the meaning and the vibration behind it, because it's a vibration of this higher consciousness of love and compassion, which is this new age of Aquarius that we are now moving into. And that has to come through the sound of the voice on an audio. But in the book, you'll read it, you'll feel the passion behind the words. Okay. But I will cover all these topic areas in the second book. Beautiful. But the second book is going to be KISS. Keep it simple spiritually. Okay. Nice. It's going to be under 150 pages or 200. Easy to read. You know, it's not going to be all this psychobabble, big words. You're going to understand it, you know, because nobody has time to read my first book, which is this huge 300-page volume, right, of this work that I've done in the past. And if you want to buy that book, it's on Amazon too. But I will release, I'll do it like a release date for that book. And if anybody wants to do a pre-order for the book, once I get all that set up, I'll put that information out. If you do go on Facebook, I will put that information on Facebook, because, you know, you can now like publish yourself anywhere, right? I mean, so, and I could do Instagram and all that other stuff, but I just do Facebook. You know, I figure, look, if you're on Facebook, you'll find me. If you plug in PTSD, trauma, spirit releasement, EMDR, my name will circulate. It will pop up. You'll find me.
Right.
And if you go on Amazon and you put any of those things or my name, you'll see my first book, the ebook, those versions. It's right there for you. Now, if you do buy the first book, I'm just going to let you know that the book itself, it's an 8.5 by 11, but it has all the energy, medicine, and diagrams in it in color. So you can actually see the colors of all the diagrams and then all the references that are in that book. And while some of it may go over your head a bit, this is what my guides always tell me. They say, just put the information out. You're planting the seed vibration. The information will download into that person's consciousness and they'll just get it. You won't even, don't worry about it. They'll get it. If it's meant for them, if it resonates with them, they'll understand it. And if at any point in time you read any of that material and you have questions, you can always email me. I'll email you back. Just give me a couple of days, okay?
Yes.
Well, all right.
We are
going
going
to
to be.
I think we're good, right?
Yes, we are going to be closing for tonight. Thank you so very much, Dr.
You're welcome.
Nagle, everyone. Also, when she does go to put her book out, I'll be posting it on my media as well to
And
let
I
you
will
know
be
when
too.
it is out, to help her out and put her in some
Yes.
also some author groups as well to get all of her stuff out there. But again, thank you so much. This has been an amazing
You're welcome.
night. You've helped so many people. We do plan to have you back again, and definitely going to be looking forward to that time. Looking forward to your new book. So everybody,
Thank you.
love and light. Thank you so very much, and we will see you next week.
Get some rest.
at
Get some
Pieces
rest.
Puzzle. Yes,
Oh, yeah.
absolutely. I've got my earbuds out because my phone is getting ready to. My camera's getting ready to die.